Telehealth has significantly expanded healthcare access for many, but a looming deadline could change that.
Here's what you need to know about the future of telehealth in the U.S. and how it could impact Medicare patients, especially in rural Kentucky areas.
Telehealth has the ability to access health care remotely and has been around since the 1960s. Created to help people in remote areas get the care they need, especially for mental health services, but it wasn't until the COVID-19 pandemic that telehealth really exploded in Kentucky. As hospitals and healthcare facilities scrambled to adjust, telehealth offered a way to continue care while keeping patients and doctors safe. That same year, Governor Andy Beshear issued an executive order expanding telehealth across the state. This allowed more healthcare providers to offer services remotely, including mental health counseling and primary care visits. The state even made sure that insurance companies would cover these virtual visits, which helped make care more accessible. Robert Spring, the telemedicine project director, has seen how telehealth has helped people, especially those living in rural Kentucky.
There are a lot of patients that don't have options. I mean, this is it for them. And if they can't see a provider through telehealth, they may not have transportation or money in order to travel and see them.
Come April 1st, the federal government will decide whether to extend these telehealth policies. If they're not extended, Medicare patients could lose their ability to access health care from home, and in-person visits might be the only option. Spring predicts that if the limitations of telehealth were to take order, the rural communities of Kentucky, where telehealth has provided much-needed access to care, would be impacted tremendously.
And my worry is that this is an issue that could kind of be forgotten. And if it's forgotten, there's going to be a bunch of people that are not going to be able to get access to health care.
Hannah Piedad, a student at the University of Kentucky and native of Paintsville, knows how important telehealth has been to her and others in rural Kentucky.
If I didn't get to have my psychiatrist from back home over telecare and be able to get the refills on my prescriptions, I would have to find a whole new psychiatrist and go through that same process, because I can't just go in and say, hey, give me so many milligrams of this and this. They have to figure that out for themselves. So I would just have to start that process over again, which would be really hard for me because I finally found the medication that works for me after about 5 years.
For more updates on the potential changes, visit telehealth.hhs.org. This was Giana Gallo reporting for Wildcat News.